Good evening, everybody. Well, today I'm going to be presenting my project, which is over methotrexate administration for ectopic pregnancy. What really made me choose this topic was I work in the emergency department. I was speaking with my charge nurse and my director and kind of trying to figure out what was one of the most pressing topics currently in the department that they were working on, and this happened to be it. And just to kind of give you guys some information on it, ectopic pregnancy is potentially life-threatening condition. For the longest time, surgery was the mainstay of treatment for women diagnosed with ectopic pregnancy. But now that we've had further advancements in medicine, we have a medication called methotrexate that can be given to women who are diagnosed with ectopic pregnancy. So pretty much what this says is, so what's the problem here? Well, in our emergency department, we do not have the availability to administer methotrexate to women who have been diagnosed with ectopic pregnancy. This is a policy that is practiced within the actual hospital that I work at, but not in the emergency department, which is kind of where we came up with this whole issue in the first place. This is primarily due to the unavailability of training of the administration of the medication in our department. We don't have any trained staff down in the department because you have to be properly trained to administer this medication. So if these RNs are not trained appropriately, then they cannot give the medication down in the ER. Therefore, we are having to have outside sources who are trained, such as oncology nurses or labor and delivery OB nurses, to come down to our floor and administer this medication to the patients. So why is this a problem is really the next question to ask. Well, this causes decreased quality of care to these patients due to the fact that they have longer wait times in the emergency department. Every minute that we wait increases their risk for the ectopic pregnancy becoming more life-threatening to them. With allowing administration, we will decrease the possibility of rupture because we are decreasing the time that we are allowing for this to become more life-threatening. We're also going to decrease their length of stay in the hospital, obviously due to not having to wait for that outside source to come in and administer the medication. We have the staff that is properly trained in our department to administer this medication to the patients when they need it. We're also going to decrease the possibility of the patient loss of their fallopian tube due to the need for surgical intervention. When these women have these ruptured, when these women have the rupture, they will have to go to surgery. And a lot of the times they just remove the entire fallopian tube in the surgical process. Doing this, therefore, decreases their ability to conceive. It increases the difficulty, and it causes problems in the family dynamic more so than just affecting the patient themselves. What does the project plan to accomplish? Well, the project is to provide enough information and statistics on why methotrexate needs to be given in the emergency department. So they will actually write a policy in our department to allow the administration through our staff and the training to our staff to be able to administer it. This project will also plan to accomplish that the ER will appropriately train their staff on the proper way to administer methotrexate to these patients so they can be treated in a timely and a professional manner. And then lastly, that the hospital will see increased patient satisfaction due to the decrease of their length of stay in the hospital and due to decreasing their risk of a worsening life-threatening condition. So what exactly is methotrexate? I've been talking about why we should give it and the reasons we should be giving it and that it helps ectopic pregnancy, but what exactly is it? So let's just talk about it for a second. Methotrexate It's an anti-neoplastic agent, therefore why I was talking about, oncology nurses, or a lot of times some of the nurses that come down to the department to administer the medication because they are trained in these anti-neoplastic medications. And what it does is it interferes with the DNA synthesis, particularly affecting the cells that are dividing or multiplying rapidly. And this prevents the conversion of a lot of really fancy words, the dihydrofolate to the tetrahydrofolate, which is essentially in the de novo synthesis of the purine nucleotides, and thymodylate. Pretty much meaning it will stop the essential substrates of the DNA synthesis, the repair, and the cell proliferation. So it's pretty much going to stop the growth of this embryo fetus into causing something, because it can't have any life if it is in the fallopian tubes. So it is also a multi-dose regimen that is only recommended for women who are hemodynamically stable, who don't have a ruptured ectopic pregnancy and have no signs of active bleeding. So those are kind of some of the criteria that the women have to meet to be able to get this medication. So the history of treatment for ectopic pregnancy. Well, like we stated earlier, surgical intervention used to be the only way to treat ectopic pregnancy. But now, like I stated earlier, with the advancements in medicine, we can administer methotrexate via an IM injection. Medical therapy for ectopic pregnancy, appealing over surgical options for a number of reasons, including eliminating morbidity from a surgery and general anesthesia, potentially less tubal damage like we were talking about earlier, and less cost and need for hospitalization, which they would need, post the surgery. And with the methotrexate administration, it's just, I know it said it's a multi-dose regimen, but 9 times out of 10, they can just get a single dose of the shot. It's proven to be 97% effective in most women who just get that single dose regimen, and that's it. And then they're discharged from the emergency department, and they just have to follow up with their OBGYN for care just to make sure that, they are having the decrease in the HCG levels, and 97% of the time, that's exactly how it works out. So there's obviously criteria for any medication that you give a patient. They have to kind of meet a criteria for retrieval of the medication. The patient, like I said, must be hemodynamically stable. Patient must have no signs of any active bleeding, an unruptured ectopic pregnancy. They cannot have any evident cardiac activity of the fetus for them to get methotrexate. And then they must also have an HCG concentration of less than 3,000. If a woman has a serum HCG concentration of less than 1,500 and still meet all the criteria above, then a single dose regimen of methotrexate can be considered. The majority of women can receive a single dose of methotrexate, and that's usually, like we said it earlier, will be all that they need to resolve the issue. And the next statement on here is just talking about how I was stating that it's 90% of the single dose regimen is 97% effective in most women. So education that you need to provide to the patients who receive methotrexate. One, they need to avoid any intercourse until their HCG is completely undetected in their blood. Avoid any pelvic examinations, any ultrasounds during the surveillance of the methotrexate therapy. They also need to avoid any sun exposure to limit the risk of the methotrexate dermatitis that could happen after the administration of the medication. Avoid foods and vitamins that are containing folic acid. Avoid any gas-forming foods, just pretty much simply because they can produce pain. And avoid new conception until your HCG is undetectable. So, what was the result of this project? Well, I presented all of this information to my department managers, and like we stated earlier, they knew that this was an issue. They knew that this was something that they wanted to change, and was already working on trying to get some information so they could get a policy written. So, I did all my research, I wrote my paper, and I presented all of this to the department, to the managers, and showing them why this was a current issue and all the statistics that I found throughout my research. And the director of the emergency department stated that he was, currently working on trying to get a policy for this. And, I can gladly say that a policy was actually made on this, and now our department is able to administer methotrexate. This is just the beginning, so we still have not had any staff that's properly trained yet, but now we are one step closer to being able to administer methotrexate in our department, which is really awesome to say. So let's just kind of recap on everything that I talked about. Prior to this project, the emergency department was unable to provide patients who were diagnosed with ectopic pregnancy methotrexate. This was an issue because the patients with ectopic pregnancy are at high risk for many things, and the problem needs to be eliminated in a timely manner. So now that the department is allowed to administer this medication, and we hope that this policy will hope to change to provide better quality care to our patients who are diagnosed with ectopic pregnancy by providing them timely administration of the methotrexate. This will increase our patient satisfaction, hopefully, and get them in and out of the hospital faster, better time, better money, better cost. It's just all over is better for the patient, better for the hospital, and better for the staff. And patient satisfaction is #1 priority in my book and in everybody else's book. So this will obviously, this next slide talks about just decreasing the patient's risk for their worsening condition, decreasing their length of stay, like I was saying, decreasing the need for a surgical intervention, and then decreasing their risk for future difficulty in conception. Alright, well, thank you everybody for listening, and I hope that you got a lot of information from this, and I had a great time researching all this information, and an even better time presenting it to my department and being able to get a policy change, and hopefully we will start seeing administration of methotrexate through our own staff pretty quickly, and I'm really excited to see that. Thank you.